Good morning, everyone. My name is Karen Hall. I'm with the P2 Collaborative. I'm the Population Health Improvement Program Manager, which is the New York State Department of Health initiative. I'd like to thank everybody for joining us on our webinar today. And you are going to be listening to Samantha Lupinetti, who's from Healthy Communities Institute. And she's going to be talking about the different components to our Keys to Health data website. And if you sat on one of our websites a few months back in February and have been on the website since, you've noticed a few changes. And we've switched to a standalone site, and then there's been some updates to the website itself. So I'm going to turn this over to Samantha, and if anybody has any questions during the webinar, then please feel free to ask Samantha. We'll also be taking questions at the end. You can type them into the chat box, and we'll feed those questions to Samantha as well. Thanks.
Great, thank you, Karen. I just want to confirm you can hear me?
Yes, we can hear you just fine.
Okay. Great, perfect, thank you. All right, well, thank you. Like Karen said, thank you all for joining today. I'm excited to be joining myself. As she mentioned, I'm from Healthy Communities Institute, so we're an organization actually based out in California, but we pull together or provide web-based information systems, taking data from a lot of publicly available sources and putting them into these websites. So I've been working with a number of the FIPs in New York State and have been working really closely with P2 Collaborative over the last year or so to help set up the site and maintain a lot of the data. Oops, and my slide, let's see, you're not advancing. Give me 1 second. There we go. All right, so just a little bit of brief background and overview. Karen already alluded to the fact that there have been some changes to the site, so I pulled this up only to kind of provide a point of reference. So for those of you that may have been using the site, hopefully using the site over the last few months, you previously used to go to the P2 Collaborative site to pull it up. It was an embedded platform on that site, and we've made a switch, a transition over to a standalone platform. So if you were previously accessing the data here, I believe you can still go there and get a redirected link to the new site, but we're now on a standalone Keys to Health website. So just a little bit of an overview of kind of where we started and where we are today. So we launched the platform P2 launched the platform in February of 2016. Maybe some of you participated in the webinar that we conducted, I think it was back in February, sort of for initially introducing the site. So again, it's hosted by P2 Collaborative. We have that original embedded platform, but have transitioned it now over to a new standalone platform. So we're sort of using this opportunity. We officially relaunched a couple weeks ago in November, and then again are sharing this with all of you who may not have been able to make that in-person meeting. That being said, all of the geographies are the same, all of the indicators are the same, so that core set of data that you may have accessed previously is still there. It covers the 8-county Western New York region, includes zip codes and census tracts when available, and then we have around 180, 190 or so indicators, kind of our core indicators, and then this hospitalization and ER data package. The data is the same. So just kind of an overview of the tools and features. I don't want to spend too much time on this right now. We'll dive into it on the live demo. But if any of you are new to the platform, kind of some of the things that you can access from the site. So we have data dashboards of health and quality of life indicators. There are indicator comparisons across geographies and subpopulations, targets to track progress towards meeting state national goals. So you'll see on the site one of those is the prevention agenda targets, excuse me. We have the Nielsen-Claritas demographic profile, which I'll pull up, and the socio needs index to identify areas of socioeconomic need that are correlated with poor health outcomes. So in addition to some of that data, we also provide some public health tools. So that's where the promising practices come in. That's a database of over 2,000 programs, policies, and interventions to identify best practices aimed at improving health in your community. We have a resource library to house assessment reports, provide planning tools and resources, an opportunity for you to highlight your implementation plan, your strategies, your goals. So I'll talk a little bit more about this, but I think this is kind of a great hub of data for your region. the report assistant to compile content for grant applications or to submit reports. We have a CHNA guide to assist with local health assessments and your planning efforts. And then we won't go over it today, but there is a back-end data scoring tool to systematically score indicators and topics. So if you are kind of in that assessment phase or will be kind of going through that assessment process in the next year or years, there is a great back-end tool, excuse me, currently back-end, hopefully front-end at some point, but a back-end tool that will help you sort of, again, sort of systematically score your indicators across a series of comparisons. So again, this is sort of just a summary of everything that's available to you. We'll pull up most of these things in the live demo today, so you can have a better understanding of kind of what they look like and their functionality. So I'll pause before we do the demo. Just quickly, I kind of want to go over the core indicators. So the platform comes with a set of core indicators. I believe I mentioned that around 145 that come from a combination of national and state data sources. So around 60% of those indicators are tied directly to health, and then the other 40% are tied to quality of life measures, so education, economy, transportation, social environment. Most of the data is available at the county level, but there are some indicators available at the zip code and the census tract level. We love to get that more granular data, so whenever available, we will try and pull from sources that do have the data at that level. When we develop the core list, we consider a number of factors. So we have kind of a New York State, or a researcher assigned to New York State, and they develop the core list based on a number of factors. So they're looking at the validity of the data and the source, the reliability of the source, and whether they'll continue to replicate their data, and then also just the availability of the data. And then the framework for sort of our indicator selection when we're choosing that core list is based on the Health and Human Services Healthy People initiative. So we try and align our indicators as best we can to a number of the Healthy People 2020 benchmarks so that you can track your community's progress against those national targets. So we'll see some of those up on the site when we go on today. And then just because I always get the question, just a list of the sources. If we share the slides afterwards, you'll have this as a resource, but it's approximately 20 sources or so, and it's a combination of state and U.S. sources. So a lot of that, again, I kind of go back to our methodology, depends on data availability, whether the source will regularly update and recollect that data. But it's in your case, a good mix of New York State and national sources. So we're relaunching, like I said, in November and now into December. So why did we go through this relaunch? And Karen sort of already alluded to this, but there were really two main drivers. So the first one was this transition from an embedded to a standalone site. So hopefully if you've used the site in the past and have maybe already logged on to the standalone site, you'll see there's some increased functionality, a little bit easier navigation, easier to get around. The data is really, no longer embedded into the P2 site. It's its own standalone platform, so they can really kind of cater all of that content and all of that functionality to individuals coming to the site specifically for the data. So we just made that switch a couple weeks ago. And then the second driver was this new dashboard launch that my organization, HCI, went through in August. So it was sort of a long project in the works for us, but with some pretty significant changes to the appearance of the data and the dashboards on your site. So again, if you have been using the site before August and then have gone on since, you've probably noticed some fairly substantial changes in the way that things are laid out. So why did we decide to build some new dashboards? First, we wanted to make it easier to find the data. So kind of a common thing that we're coming back to, we want to make it as easy as possible for a visitor to the site who hasn't visited before to kind of come in and find exactly what they're looking for. We wanted to present more meaningful comparisons. So one thing we heard over and over again from our clients was that people wanted more context for the data on the site. So we had a lot of those comparisons in the back end. We didn't have a way of displaying them yet. Now all of the comparisons that we have available for our indicators are available on the front end. The idea of visualizing more data. So the more we know, the more you can visualize the data, the easier it may be for you to make decisions or to present the data to decision makers in your organizations or in your community in an easy to understand format. So there was a big focus on being able to visualize data more easily. We wanted to help you as users of the site to tell stories with the data. So sort of echoing what I've already said about having more visual components and comparisons available, there is an increased focus. We know there's increased focus on sort of the data telling a story, whether it's for getting grant applications or bringing in community partners. And so hopefully some of the new tools can kind of help you tell that story more easily. And then again, just presenting compelling and interactive visuals. So our website or technology was dating back to, early 2000s, and so we wanted to kind of update that and have some more interactive tools and visuals on the site. So just a sort of a side-by-side comparison, again, this is probably only applicable to those of you who have used the platform before August, but I'll just kind of quickly go through to show you what's available now after the release. So old dashboards, you could only look at a single location at a time. New dashboards, multiple locations. Same as your comparisons, so the difference of looking at a single comparison to now being able to display multiple comparisons for a single indicator. The limited search capability. So in the past, there was sort of a clunky search tool at the top of the community dashboard page. Now there's an advanced search and filter tool. We'll go through that when we go into the demo. That really allows you to customize and cater the dashboard and the data that you're looking at. So the ability to save data more easily. So in the past, you could kind of save and download snapshots of the data or screenshots. There are now a series of tools that will allow you to save indicator data and graphs and charts a lot more easily. So I'll point out how to do that. But this, again, was something that we consistently heard from our users. We need a way to more easily kind of download the data in a format that where it's easy for us to directly insert it into a report or a grant application. Kind of the switch from an outdated graph and look and feel to this new improved graph and indicator view. And then the idea of the single community dashboard to the ability to create and save multiple dashboards. So we'll walk through that as well on the demo. And then since then, so that all happened in August. If you've even gone on to the site in the last couple months, once we had that big release, it sort of freed up a lot of our developers' time. There have been some really, in my mind, beneficial changes that have just come out in the last releases in October and November. So a couple things you'll notice on the site, there's a new trend comparison. So rather than just showing you a comparison to the previous value, we're actually calculating a trend looking at somewhere between 4 and 10 previous data periods to determine whether there's a significant increase or decrease based on the 4 or more previous time periods. Confidence intervals, so a big ask for a while. Those will now display, you can see it kind of on the slide here, on any of the graphs on the site. So that, again, was something we had available on the back end, didn't have a great way for displaying it yet. So when those are available, and they're not always available, when they are available, you'll be able to turn those on and off on any of the breakout or time series charts moving forward. This idea of multiple measurement periods, I'll point this out when we go through the demo, but previously you could only view the breakout values for the most recent time period. So we would show you the time series graph and say, okay, you can look, in this case, we have the values from 2010 to 2014, but as far as the breakout values, so breakouts by age or by race, ethnicity, or by gender, those were only available for the most recent time period. Now on the indicator detail page, you can select the measurement period, and it's going to show you all of the historical breakout values as well. And then we launched a new help center and a website kind of bot, and so I'll point that out when we're on the site, but there are some great resources available. So if you're going through and you have some questions about the data or how to use a certain tool, there are some great kind of help center pages, and you can, with the new little widget, you can directly ask a question while you're on the site. It'll sort of tour with you as you go from page to page. So you could pull up some content, whether it be about icons or comparisons or how we calculate the trend. So I think that'll be a really great resource. All right, so enough of me talking about that. Let me show you some more of what I'm talking about. So I'm just on the new site right now. One thing I just want to point out, again, we switched over to the standalone site, so the URL, you can ignore this last part here, but the new URL, k2hwny.org, so it's now in its own sort of standalone site. Same banner idea, so we're sticking with keys to health, but you know, now you have some up top navigation where you can navigate to all the different pages available on the site, and the home page looks a little bit different. So rather than just a series of icons, you've got some things that P2 would really like to highlight for you. So easy access links to dashboards, county profiles, the community spotlight or the prevention agenda, kind of a focus this month on diabetes, a featured indicator, and then they've done this really nice community spotlight feature down at the bottom where they're pointing out or highlighting some things that are happening locally in your community. So with some links to the exterior stories or pages. So I know that this is all content that they plan on refreshing regularly, so certainly come back to the site and kind of check for updates periodically. So let me just get started. I'm going to kind of go through and highlight some of these changes. So this is what we're calling kind of the new dashboard landing page. Again, if you've used the site previously, pre the August release, when you clicked on Community Dashboard, it took you to a single dashboard, and from that drop-down, you could select the location. In this case, you have a number of options. So you're coming in and you want to search for a specific topic. Say you're looking at obesity, you can come in and type a word. You do that, you're going to get a list of all of the indicators on our site that are associated with the topic of obesity. So some of these will be kind of more of those direct correlations. You'll see, okay, adults are obese, adults are sedentary. But there will be some other indicators that are sort of, you know, secondary, second topic or whatnot that are tied to obesity. So you can come in here, kind of look at this list. If you wanted to show this all on a dashboard, you could do that. If you want to go through and X some of these out, you can do that, and then you would pull those out. You can also, if you click on this, it'll take you, you just saw that screen pop up, take you to the indicator detail page. I'll hop on that in a minute, but if you really, you know, you're really focused on adults who are obese, that's going to be your focus. You want to access all the data on that. You can certainly click on this link, and it'll take you to the indicator detail page for that indicator. So that's one option. This is sort of the more general keyword search. You can also come in now and you can search for a very specific indicator title. So if you know that you are specifically looking for an age-adjusted death rate to breast cancer, or I was actually going to go for a hospitalization rate, let's say. So age-adjusted hospitalization rate due to diabetes. You can start typing that in, and the search bar will start to populate then with the indicators that meet your indicator name criteria. The third kind of general search option up here then, or I'm sorry, more specific search option up here is this idea of finding a location. So if you're coming to the site from a specific county and you want to see all of the data that's available for Allegheny County, you can certainly click on the county, or if there's a problematic zip code that you really want to see what data is available at the zip code level, you could scroll down here. We have county, we have region, and then zip code and census tract. So kind of that third option of searching for a specific location. So those are helpful tools, I would say, when you're coming and you are looking for something very specific. If you don't necessarily have a specific indicator, but you're more in an exploratory mode, we have what we call down here these curated dashboards. So let me just click on the all data, pull that up as an example. So this displays, as the title suggests, all of the data for the selected location. So right now we see the default we're on Allegheny. Similar to the old dashboard, it's sort of showing you this list of all of the indicators, but there's some major differences. So in the past, we would show you the indicator name and then a single kind of default comparison. You now have the indicator name, you have the actual value and the measurement period. And then over here, I mentioned one of the big purposes of the relaunch was this idea of showing multiple comparisons. So you can see now there are multiple comparisons that are displaying. So we not only are showing a comparative distribution of New York counties, we're showing you the New York State value, the US value, And again, this is all just sort of based on the data or the source availability of this data. So we, whenever we can, and whenever the exact kind of indicator definition aligns, we will put as many comparisons as are made available. So the list will kind of go on. It's still grouped by topic and subtopic, but again, the list just gets a lot longer now with all of the additional comparisons. And again, this is all of the data available for this specified location. You can select from the drop-down up here and change that up. A couple other things I'll point out on this page. So over here you have this See the Legend button. With the introduction of so many new comparisons, there's a lot more to kind of keep track of. Hopefully this will become fairly kind of practical, I guess, or so, you know, intuitive as you're going through. But for the time being, as you're sort of getting familiar with some of these comparisons, the legend will travel with you wherever you are on the site. So, you know, if you have a question about kind of that gauge or signature gauge, or you've noticed some of the, you know, the new triangle that's representing the prior value, the legend will indicate what those specific icons represent. In addition, there are two other buttons up here. So card mode, what we call this kind of view right now is our condensed mode. Again, there's still a lot of data, but this is kind of a whiter background. You could do a print option up here of this screen, and it would display all of your values. But if you're coming in and you want to download some of the data, which I mentioned, kind of saving data was a big priority in this release, you can switch to the card mode, and when you're in that mode, you can save any of these cards. So if you click Save Card, it's going to populate, you could save it, and then you now have a PDF or a JPEG, excuse me, of the cards you are going to insert it into a report or a summary, an email. You can do that. So sort of an easier way to download data. The other option is this turns colorblind mode on. So when I do that, oh, there we go. Sorry, I clicked off too quickly. You'll see the little thumbs up and thumbs down next to these comparisons that are in red and green, so that if you're printing this out in gray, or if you're sharing this with people who may be colorblind, you can see whether these are comparing favorably or not favorably according to the thumbs up or thumbs down. And these two options, I'm showing you them on this particular dashboard, but these will be on any of the dashboards that you look at. So I'm going to quickly kind of go through the rest of these. The Disparities Dashboard, if you were on the site before, this was an existing dashboard that we already had, sort of has just gone through the facelift that the rest of the site has. But one of the things that I wanted to just point out, so I'll take a step back. Disparities Dashboard is pulling in all of the indicators for which we have some type of breakout data. So the main categories, again, are breakout by age, breakout by gender, breakout by race, ethnicity. And so for any indicators that have one or all three of those will get pulled into what we call this Disparities Dashboard. So it's going to display the indicators of value in the comparison, similar to the All Data Dashboard. The one difference that you'll see here is the breakout chart. And with regard to kind of ease of download, you'll see there's this little, what we call a hamburger icon up here. And if you click on that, you're able to download the image, or the graph, excuse me, in a couple of different formats. So you could print it or download it as a PNG, a JPEG, a PDF. So sort of a nice option if you're focusing or you're honing in on, some specific differences between populations in your region. So those are all housed in the Disparities Dashboard. You also then have, I'm going to kind of talk about the two of these in sync. So the Healthy People 2020 Progress Tracker and then the New York State Prevention Agenda Tracker. I'll just click on this one. So before the release, we used to treat dashboards, so we've been looking at, and trackers, which are sort of custom lists of indicators with targets separately. But with the release now, the trackers have become these curated dashboards. So if we open this, or now that I've opened this up, you see that it's a list of indicators with all of the prevention agenda targets and the icons indicating whether or not the targets have been met. So in this case, we know the prevention agenda is a big focus for New York State and for the FIF in particular. So this is just going to pull together all of the indicators on your site that have prevention agenda targets. And you can see there's sort of a mix, so some of these targets have been met, some you're still sort of working towards. Similar to the other dashboards, you can come up here and change by county or view by region, just based on what's of interest to you. So that's, excuse me, that's true of the New York State Prevention Agenda targets, and then also of the Healthy People 2020 targets. And then the last dashboard that I want to pull up here is the indicator list by location. So this, again, was something that sort of came out of client and site visitor requests over the last few years. This idea of just being able to come to one spot and see all of the different kind of locales or locations that indicators were available. So a lot of times someone will come in and they're searching for, in this case, searching for adults unable to see a doctor at the zip code level. Well, the issue is that nothing's coming up because we don't have that data available at the zip code level. The source just doesn't collect it. So the indicator list by location just gives you this comprehensive list of all of the indicators that are available on your site. They're grouped by the topic, and then it's telling you what geography that's available at. So as we go down, we'll start to see, I mentioned our ER and hospitalization rate indicators as sort of an additional set of indicators. Those are available at the zip code level. There are a couple of other, I think, if we scroll down, I noticed that New York State is unique. They have a couple of indicators that are available at the, right here, some of the maternal, fetal, and infant health. They do collect that data at the zip code level. So this can just be a great resource if you're going through, you're confused by something that you would expect to be in the list is not coming up, or sorry, in another dashboard is not coming up. This can be a great resource for you just in finding out what's available. So all of these dashboards, the 5 that we've listed here, we're calling these curated dashboards. All the ones that are currently set up are set up by default, but the P2 team has the ability to add in more dashboards here. So if there are certain sets of indicators that you're frequently looking at that are important to you or other organizations or individuals in the community, I think this is a great opportunity. We really, and P2 really wants to make this site a site for all of you as users and visitors. So there's certainly an opportunity for them to add in some more curated dashboards based on what data and indicators are most important to you, what you're regularly or frequently coming back and accessing on the site. So if you are interested in that, I certainly encourage you to kind of talk to the P2 team and to Karen about adding those in. The last thing that I want to pull up just from this indicator, kind of our dashboard landing page, excuse me, is this idea of building a custom dashboard. So I mentioned as I was going through the slides that in the past, the search tool really was a little clunky, didn't work all that well, you didn't have the ability to kind of manipulate the data as much as we would have liked. So we built this new Build a Customized Dashboard tool. This is a great opportunity if you're coming in and you kind of have a very specific set of data that you're looking for, and you don't want to have to scroll through all of the curated dashboards to find it, or you're looking maybe at 5 separate indicators. You don't want to just individually look for each one. You can pull those into a dashboard. So if you were coming in and say we were looking at obesity indicators, but then maybe you also wanted to look at, let's see, I was thinking low access to a grocery store. So maybe you're pulling in a very specific set of indicators, but you have those indicators in mind. You can come in, you can do a search. If you start clicking in this field, you're going to have access to all of these different indicators that are available on the site, so you can sort of see what populates. You could then filter by location. So say you're really just looking in Erie County. If you wanted to only display certain comparisons, you could select those. Similarly, if you wanted to display those subgroups, so those breakout counties, or excuse me, breakout values, you could do those as well. So you come in, you've selected your handful of indicators. You can run a search, and you'll see then down below it's going to display the indicators based on your search criteria. So I was looking at a specific location in this case. I had a couple of indicators. This is sorted at this point by topic. So we have a couple of indicators that fall under the topic of exercise, nutrition, and weight, and then built environment. So you kind of had your custom dashboard based on your criteria. And if you come up here, you can save a link to this search. So if you want to kind of routinely come back and things will routinely come back and be checking on this to see if there are updates, you can certainly save the link. You also, and it has its limitations. We're always working on kind of print or PDF functionality, but if you want to print this page, it will show the criteria. The one kind of limitation right now is it shows this your filter criteria up top here, but it will also give you a display similar as how you see it here of all of the indicators that you pulled into your dashboard. So that's always an option as well. So this is if you're searching for a specific kind of coming to the specific indicators. There's also this option over here of filtering. So rather than hand-picking indicators, maybe you want to come in and you really just want to search by topic. So you're focused specifically on children's health. Or you want to look at a specific age group. So you're looking, you're really focused on elderly health, not going to align them with the topic I selected, but if you wanted to sort of sub-filter children's health and then children as well. Or we have this new field, filter by classification. So this is something new with the release, this idea. We kind of are repeatedly hearing from clients that we want indicators sort of grouped by a classification. So these are based off of the county health rankings classifications. So we identify each of the indicators on our site as a health behavior, a health outcome, clinical care, physical or social determinants of health. So you could also just come in, skip all of the other criteria, but just look for health behaviors with a specific, or within a specific location. And then comparisons and subgroups we've got down here. Two things that I'll just point out up here, I don't want to skip over. So the first field was already populated because I selected it when I was on the hand-pick indicators view, but when you're selecting locations, you have the option of just typing into the drop-down. So you could start to do, if you wanted to pull up some specific zip codes, you could do that by typing in or start typing in, the name of the county or the numbers of the zip code. You also have this option of selecting by a map view. So we recognize that you may not know the specific zip codes or census tracts, but you might be able to pick them out on a map. So if we wanted to kind of look at this from the zip code view, if you have an idea and you want to come in and just click on maybe these zip codes in the bottom left corner, you could do that. Those are all then going to populate. If I X out of this, then those would be listed there. And you can always clear the field by just clicking this X. What I skipped ahead and did there was if you want to do all of the zip codes or all of the census tracts for any of the county in your region, you can do that as well. So that's another option, not on the specific map, but just an option listed out down here below. So two kind of easy, hopefully easier options for you as you're going through and setting your criteria. Same is true then for the topics. So if you just wanted to do all health topics, all economy topics, all education, rather than having to individually select those, you could select all and run your search. Okay, so I want to leave some time to get to some of the features, but before we do that, I just wanted to pull up an indicator detail page, so I don't want to skip this. So at any point in the site where you sort of, any of these views, where you're looking at a curated dashboard, whether it's one you created or one that's, a custom dashboard you created or a curated dashboard that's listed for you, you can see that when you hover over the indicator, it's a hyperlink. So that is always going to take you to what we call the indicator detail page, and I have one of those pulled up here. This is kind of all of the data that we have on the site about the indicator. So you have the title of the indicator, you have the location drop-down over here, so you can see all the locations that are available for this indicator. The new feature that I mentioned that we just came out with in the last month is this idea of selecting measurement period. So in this case, we have data for 2009 and 2014. For a lot of the indicators on your site, we may have kind of our goal with indicators is to have at least the 4 previous time periods. So you'll be able to access those when available. So down below that, you have kind of the very specific definition of the indicator. You have some kind of public health context for why this indicator is important, why we feel there's a need to track this. You've got your value, your source, measurement period, maintained by, and then the last update date. So the maintained by, that's going to show Healthy Communities Institute, but something that P2 Collaborative is working on, and I think is kind of eager to hear from some of the individuals in the community and some of the organizations about what would be most relevant. They're working on adding in some local data. So again, a lot of our indicators are coming from state and national sources, but you guys may be collecting some really rich local data, and we'd love to make this site the hub of all sort of Western New York data. So I know the team there is really interested in adding in, and has already started adding in some local data. Whenever the data is maintained by P2 Collaborative, it's maintained by field, or has been added by P2 Collaborative. This maintained by field will then display P2 Collaborative instead. Over to the right here, you have all of the different comparisons, and you'll see kind of in contrast to one of the curated dashboard pages, you'll have some additional context when you hover over. So in this case, you know, this is a compare to distribution of all New York State counties. It's going to show you what the cutoffs are for the 50th percentile and then the 25th percentile. There's sort of a technical note about the distribution, and then some additional information about that gauge and what it represents. For the other values, you know, some of these may be a little more straightforward, but it's just going to provide you some additional information in the hover over. Down below that, you're going to have any of the graphs that are available. So in this case, for this indicator, the one is the time series graph, just the change over time. Similar to the breakout charts, which we don't see on the screen, you have the option of displaying, or excuse me, printing or downloading this graph, and then also displaying the confidence interval. So I mentioned that was a recent change. You can do this through the icon over here. You could always turn on or hide the confidence intervals, and those will not only appear when you're viewing the page, but then also if you were to download the chart now, those confidence intervals would appear. And if you hover, I should say, if you hover, you're going to see what the range is. So that's sort of a new update. Scrolling down here, you then just have some mapping and chart and even table functionality. So you've got the map for your region over here. You have the a chart kind of displaying all of the different county values for this indicator, and the table's going to list the values as well. So something nice, you're able to download the chart, you're able to download a CSV of the table. We're working on the ability to download the map in a high resolution format, so that should hopefully be an upcoming change. You can also kind of expand, if you want to see the map or the table in larger format, you can do that as well. What you'll sort of notice as I'm hopping around here is that these three tools all interact. So if you're clicking on a specific county in the map, it's going to highlight that over here in the table, or excuse me, in the chart, and then again in the table. It's also going to populate with the Erie County value up top here. So everything's sort of interactive on the page. And then this is just showing you sort of, it's a grouping, a natural grouping of all of the counties, just lowest value to highest value, but there are some other comparison displays that you can lay over the map and the chart. So if you wanted to compare to show how your counties compare to other New York counties, this is in keeping with that gauge. So you'll see these are the indicators that are in the top 50th percentile, these are in the bottom quartile. So it's just using that same color coding to display where they fall in that comparison. For New York State value, you can see that actually for this indicator, all of your counties are below the New York State value of 24 point, or excuse me, are above the New York State value of 24.6. So kind of an area of improvement across the region, US value, your targets, and so forth. So you can, I think that's a really nice tool, kind of being able to display those comparisons in a very visual format, especially if you're looking at this, not just a specific county, but you're looking at, you know, the entire region as a whole for the work that you're doing. And then finally, down below that, you just have some additional context about the data and then some related content. So if you're focused, you know, you're on this indicator about obesity, you can scroll down here below. There are going to be a number of other indicators or promising practices that are similarly tied to that, that topic. So a lot of data. Hopefully I didn't make that too confusing, but there have been a lot of changes. You know, if you use the site before August, then the detail page, indicator detail page, the dashboards look a lot different. And so hopefully this is sort of a good overview of just what some of those changes are and how you'll access that data moving forward. All right, so in the last kind of 15 minutes of the presentation, I just want to go over some of the other features. So right now we kind of just focus on all the core set of indicators. I'll just quickly go through some of the navigation up here. So Find Health Data, that was the tab that we were using to get to that dashboard landing page. Demographics data. So if I click on this, you'll see this is going to take you to about 100, I believe, Nielsen Claritas demographic data points. So this is looking at population, race, ethnicity, household income, education, and so forth. So all of these are available to you here. You can click on these and pull up some kind of additional views of the data. So you can download the table. You can change the location. This is still a little clunky and it's probably going to get updated at some point. What's a lot nicer, and this is sort of the second tab. So I clicked on demographics data. If you're just purely looking for the data, you can click on that. We also have these demographic charts, and I pulled these up already because they take a moment to load. So if you click on demographic charts, it's going to take you to a screen. Eventually we'll have some sort of shape outlines for each of the counties. But right now you can click on any of the counties, and then you're going to see the demographic charts that we have available for that area. So it's going to take you to a page like this. I clicked on Erie. Again, I'll just warn you, these pages take an extra 10 or so seconds to load. So I pulled them up in advance. But you're going to have a page that's kind of going over your population overview in data in some chart format. So usually there's around 3 or 4 charts per page. Race, ethnicity, I'm on the household income and size right now. You could also do educational attainment. So this is sort of our standard set. We went through and said, these are probably the 12, 16 demographic data points that are most frequently pulled from sites, and that we're making them available, again, specifically at the county level. But this is another opportunity, if you're using this demographic data a lot and there are some charts that would be really beneficial to you, P2 Collaborative has the ability to create these on their end and to make them available to you. So, if you want to compare a couple of different counties or you want to look at all 8 counties for a specific data point, you can relay that information and they can set these up and post them elsewhere on the site. So this is sort of a standard set right now, but we can certainly build these out based on what demographic data is most relevant to you. Similar to all of the other charts on the site, we use the same pie chart technology. If you click on the icon, you'll be able to download these in a couple of different formats. So this is really great if you are doing the report, rather than having to pull the data from the site in a table format, put it into Excel, create the charts on your own. Hopefully, you'll just be able to come in, pull a chart directly from the site and not have to go through kind of that additional step of creating it on your own. So I think these can be a really valuable resource. This is something that is available now with a standalone site. Going back to the navigation, so Find Health Disparities, that was the Disparities Dashboard that we looked at. Healthy People 2020 in New York State, again, those are dashboards that are also made available through this Find Health Data page, but you just have their independent links in the drop-down here. Socio Needs Index. So I'll open up this. I alluded to this earlier. This is an internal tool. This is a tool that we created a few years back. That's a measure of socioeconomic need that's correlated with poor health outcomes. So it's displayed on an interactive map where you can come in and identify which zip codes in your community have the highest level of socioeconomic need compared to your region and to the U.S. So when we went and created this, all of the zip codes in the United States are given an index value from zero, which is low need, to 100 being high need, and then they're ranked from 1 to 5. So you'll see the rankings down here. All of the 5s are correlated with darker areas on the map and correlate with areas of greater need. So the index value is comprised is that we're looking at 6 different factors, kind of went through and determined what the 6 best kind of indicators were to determine or that have determined socioeconomic need, rank all of those, and then you can display it as the entire region, or you can come in and you can kind of customize your search. So if you want to just look at a specific county, say you're looking at Allegheny, you want to rank all the zip codes, and zoom in on the map. But it's going to then kind of update your ranking based on the region that you're looking at. So something that was a 5 when you're looking at the entire region, when you're looking at this region, may actually be a 4 when you're looking at the entire region, because it's sort of relative to the location, the geography that you've selected. So the index values will always stay the same. Those, again, are based off of all U.S. zip codes. The ranking will update based on the geography that you've selected. So you can come in and kind of customize this. The CSV option right here, similar to the tables on the indicator detail pages. If you wanted to download all of this data, if you may want to, we certainly, for our assessments that we do for clients, will always include the socio needs index, kind of for the CHNAs as an area or as a way of identifying some of the geographic areas of highest need. You can include a snapshot of the table and a map in some of your reporting if it's applicable. So I believe, and that is the last tool, this Customize a Dashboard button. That's just going to take you again to that opportunity to build your own dashboard. So moving on, WNY reports. So there is both a collection that P2 Collaborative has started to build out of local reports. This is another area where I think it would be great if there's reports, if there are infographics, presentations, things that you've done that you think would be kind of a great resource or tool for others in the region. You can certainly submit those to P2 Collaborative and they can upload those to the site. They're just starting to kind of build out some of these collections, so local reports is one of those. There's also this Create Reports option. So this is a great tool. I've heard a lot of clients going to be using this for some of their grant applications. So if you're coming in and you can search by keyword. It looks like I've used diabetes in the past. So you can come in, search by any keyword. It could be, drug use, diabetes, poverty. What it's going to do is pull up all of the content on your site that has been associated with that keyword. So in this case, we're going to see all of these indicators. So if you wanted to pull a couple of indicators over, I'm just kind of arbitrarily selecting promising practices. So we're going to talk about this database in a moment, but you could pull in some of our promising practices if those are something that you're interested in exploring. And then down below here, as you start adding those local reports and local resources, those will become available as well. So that kind of the resource library right now is limited in what we've added to date, but as this grows and this expands, all of those resources will also be available to you when you do come to the Report Assistant tool. So you could come in and customize the report. Example, diabetes. If you want to include sort of some text explaining why you've pulled together this content, you can select different locations. So say I'm just looking at these 4 counties. You can select all counties. It's up to you. You could only select a single county. Pull that in. If you wanted to do any specific you're going to be prompted as you go down the list if you want to add in additional content, that would appear as text in the report. And then you can fill in an email address here. So if you wanted a link to the report, if you think maybe you're going to come back and edit it over time, you can either save the link once you create it, or you can email yourself a copy of it, and then you'll be able to either share it or come back and edit the link. So if I click on the report, again, you have the link for the report and to edit the report up here. And then you have your customized report based on what you pulled. So in this case, I selected a few indicators. This is the first indicator. You've got all the different county values and their comparisons. Your second indicator, third indicator. This winds up being a lengthy report just because I chose so many indicators and locations. But then you're also going to get that little snapshot of the promising practices. So again, if you've identified a problem in your community, you've potentially used the promising practices database and have identified a couple of programs that you're interested in implementing, And then maybe there are, in the future, are some other resources on the site that you'd like to link to. You can, you select all of those, and then you have this report, which you can, the print tool works really, you can either save as a PDF, so that's the option up here, or if you want to print it, either print it out or save it as a PDF in the print option, you can do that as well. So I think that that can be a great tool, again, as you're sort of going through the, I've heard a lot of clients have used it most as they're going through the grant application process. Under resources here, CHNA guide. So this brings together resources to assist you in the assessment process in an easy-to-use sort of step-by-step format. Let me just pull up, I'll click on Assess. It'll give you an idea of how the guide kind of works. Something that's really nice is that it's going to tie you back to all of the tools and the data that's available on your site. So we've broken down the assessment process and kind of assessment and implementation strategy or improvement plan process into these 3 steps. So assess, prioritize, and design. I clicked on the first one. You see there's sort of a series of steps. Within each of those steps, there's then a series of sub-steps. So I'm just going to kind of expand all of these out, and it's going to walk you through, okay, the first step in the process, defining your service area, researching your demographics. There's going to be the link back here to the demographics dashboard. There will be a nice example to another report and how they kind of describe their demographics. It'll take you back to the socio needs index. It has some tips, some language specifically from the IRS. So this guide is, we do work with a lot of hospital clients. The guide is catered to the, or kind of specific, excuse me, to the CHNA IRS guidelines, but it's certainly a tool. I mean, it kind of applies to any sort of assessment process. It will, just as you're going through, you know, the IRS language is going to refer back to that CHNA requirement that nonprofit hospitals have to complete. So each of the steps is going to sort of follow the same format that you can go through. It will again link you back to not only this, I think, is another one where it's going to be a lot of sources on the site. Something that I love is that it has some outside sources. So if we click on prioritize and show these, you know, there aren't a lot of tools specifically on the site for prioritization, but if you click on, you know, the prioritize bubble and then these steps, you'll see as you go down here, you know, we've selected a number of methods that are sort of the most frequently used methods, and if you click on the Learn More button, it's going to take you to an external website that goes into each of those in more detail. So it can just be a nice, even if you've gone through the assessment process and you just sort of want to cross-check what you've done, or if you are approaching this in the next year or two, this can be a nice tool just to sort of serve as a point of reference. Other resources, so promising practices. I mentioned this very briefly when we first were going through the slides. This is our database to share practices that show real potential in improving community health. So these are curated by our research team. They sort of scour far and wide to find programs, and then they do a write-up. So a couple of different options here on the page. You can certainly, if you're doing some really great work in your community, submit a promising practice. We can even flag those as local on your site. So this is a great opportunity to share some of the work that you're doing, especially if you've done any sort of evaluation. Those are certainly encouraged. And we have all of, you know, we have 150 some odd sites in over 40 states. A lot of the practices that are up on the site now are actually submitted by some of the organizations in the communities in which we're working. You can also come in and search. So I mentioned the database has over 2,000 different practices. You can come in here and kind of specify your criteria with a search word or by a kind of a ranking, a target audience, a subtopic. So that's available to you. And then for each of these, you know, as you go through and specify your search, each of these practices, similar to our indicators, they're coming from different sources. So these are coming from peer-reviewed journals, they're coming from our clients and our client partners, but everything's sort of in that same standardized format. So you've got your description, your goals, your mission, your impact, the accomplishments, the results, and then something that I think is really great is this contact information. So whenever available, we will always provide some contact information for the program so that if this is something that you're really interested in implementing and you have some questions and you want to reach out and get additional information, you're able to do that. So I'm not really giving the Promising Practices database justice in a short amount of time, but I would say it can be a really great resource, and I highly encourage you to check that out. Two last things that I just want to quickly point out in my last couple minutes, funding opportunities. So this is something that is maintained by Healthy Communities Institute. So these are all national opportunities. They're not state-specific, but P2 Collaborative may over time add in some state-specific funding opportunities. And these are one of the nice things, if you are looking for funding, seeking out funding, you can come and these are all timely. So we also have a researcher who sort of is responsible for maintaining this database. Whenever new funding opportunities, national funding opportunities are made available, he'll put these into the system, and then they expire when they're no longer valid. So if you come to this page, everything that's on the page is a current open funding opportunity. So again, if you're kind of getting great as you're getting into that planning stage. And then the last but not least, I apologize that I'm kind of rushing through these last few, the resource library. So this is, I've kind of alluded to this with the WNI report. It also houses the funding opportunities. This is the hub for all of the content, non-data content that's added to the site. So that can be, it can be local reports, it can be presentations, it can be webinars, it can be meeting minutes, sort of whatever is most relevant to your community. So we're still in the early stages of sort of building this out. I've certainly seen resource libraries kind of get up into the thousands. So I certainly encourage you, if you do have content that you think would be relevant to others visiting the site, to contact P2 Collaborative and share that with them. So again, I apologize. I kind of quickly went through everything at the very end there. I will just end on by going back to the slides very briefly and say kind of next steps for you, what you can do. These are probably all things that I've mentioned during the presentation, but use the site. So we certainly encourage you, if you've already been using the embedded site, that's great. Please use the standalone site. We're really hoping to drive some traffic there and to make this a very valuable resource for the community. The rest of these, hopefully we can share the slides, but suggest curated dashboards if there's data you're pulling up, if there are resources you can add, if there's local data that you have, we certainly encourage you to share all of that with P2 so that we can get it up on the site. All right, so Karen, I know I didn't leave much time for questions. I don't know if any have come through.
Samantha, yes, we did have one question, and it's about citing sources. So how do you want the data cited? From the original source in Keys to Health, the P2 Collaborative of Western New York, what is the preference?
That is a great question. So the one, I would say the thing that comes up for the Socio Needs Index, we usually request that you cite the source, cite the website as the source, because that's an internal tool. For the data, we don't have specific guidelines for that. I can certainly ask research. If you want to cite the original source is always listed there on the indicator detail page. But let me, I'll follow up and I can email you, Karen, and you can follow up with whoever asked the question. I don't think we have a preferred template or kind of guideline for how we would like you to cite sources.
Okay, thank you.
Sorry about that. I will follow up.
Anything else? Any other questions? Sorry, you could quickly type them into the chat box. Okay. There was a question if we'll be sending the PowerPoint, and yes, there will be the PowerPoint available on our P2 website, along with the recording of this webinar. And there's a question about screenshots, but actually what we'll be doing is we can send the slides, and we can also upload the webinar, so you'll have both access to the slides and the webinar. There was another question, Samantha. Can comparisons be made to specific non-Western New York counties?
Good question. So currently, no, it's only going to be the data that's available and the comparisons that are available are only the 8 counties in Western New York. The one thing that I will mention, you know, I can't think, I have to think back to a New York State map. We do have other FIP sites where the other geographies are available, so that's always sort of a resource for you. If one of the kind of the neighboring counties is of interest, we can see if that's on another one of the FIP sites. But for right now, all of the data that's available is only going to cover those 8 counties. It's not like we could compare to another state, or excuse me, another kind of neighboring county on the current platform.
And there was another question. Well, first a comment. This was very impressive. Are there comparable organizations/resources like your own for other regions? I can probably cover that as well. So with the FIP program, there's 11 different FIPs throughout New York State. And Samantha, maybe you can help me out on this one. I'm not exactly sure how many different regions contract with Healthy Communities Institute, but other regions do have a Keys to Health-like site. It's going to be called something different, but I would say maybe 9 or maybe 10 out of the 11 regions have this similar data, the similar website.
Right, so we're only working, I think, with 8, but I can certainly share this with you. And Karen, something else that we can do, I think one of the other FIP sites has done this, is to link to all of the other FIP sites on a page on the platform. So that might be, if that would be helpful, we can certainly do that. But I can just say we work with the Capital region, the Adirondack region, I'm thinking Fort Drum, but I can't think, the North Country, Mohawk Valley. I know I'm missing a few there. But I'll send all of the sites over. Again, we can link to those on the site on the page if that would be helpful, or you can forward that along.
I think that would be very helpful. Thank you for that.
Yep.
So are there any other questions before we sign off? And while you're thinking of any last questions, we will be sending out an evaluation of this webinar, and then also through that you'll be able to, there'll be a link included that will take you to the slides and the recording of this webinar. And of course, if anybody ever has any questions, you can reach out to us here at P2. If you have questions about the site itself, we can help you with that. And I'm not seeing any other questions coming through, so I believe that that would be it for today. And thank you, everyone, for attending the webinar today. And a special thank you to Samantha for presenting on our webinar today and for coming out to Buffalo 2 weeks ago to do the live presentation. We appreciate all of your support and your help. And everyone, please stay tuned for more updates from FIP.
Great. Thanks, Karen.
Thank you.